Have you ever thought that Medicaid would always be there when you need it? That just keeping your insurance card in your wallet means everything will be fine? That feeling is understandable, because you're still able to see doctors, still receiving medications regularly, and everything seems unchanged. But while you're comfortably living with your familiar routine, discussions are happening in Congress, and policies could change at any moment. When policies are enacted, you could be affected immediately, without time to prepare. A small change on paper could cause you to lose your healthcare rights, interrupt your medications, or burden you with unimaginable medical expenses. If you're living on Medicaid or have loved ones dependent on this system, this is a video you cannot afford to miss. We'll analyze 5 potential changes that could turn everything upside down, and, most importantly, how you can proactively protect yourself starting today. Please hit like if you find this information useful, and share it so others won't be caught off guard by what's coming. Imagine you're a father, a retired mother, living on a modest income and relying on Medicaid to cover medications, regular checkups, or long-term care. Each time you visit a doctor, get medications, or take a family member to the hospital, you still believe that insurance card is a stable part of your life. It's like the ground beneath your feet, seemingly solid. But right now, while you're living your routine life in Washington, Congress is discussing policies that could change the entire system. No one is telling you that you'll lose your benefits tomorrow, nor is anyone guaranteeing that everything will stay the same. These are just discussions, proposals that could completely change how Medicaid operates. They haven't passed anything yet, but what they're discussing, from budget limits, changes in eligibility requirements, to tightening assistance, could be approved at any time. And what's worth noting is, not everyone knows, not everyone has time to prepare. In reality, if Medicaid tightens tomorrow, if new regulations are applied, if paperwork becomes more complex, are you or your loved ones sure you'll retain your healthcare rights? You're not powerless. In fact, you have a strength many people overlook: preparation. You can proactively review your benefits. Ask your healthcare center. Update your records. Get information from reliable sources. And in times like these, being proactive isn't about worrying too much. Being proactive is living realistically to protect your existing rights. When it comes to changes in the Medicaid system, many people think it's the government's business, legislators' issues that have nothing to do with everyday life. But the truth is, every change begins with a meeting and ends with your prescription, your insurance registration form, or worse, a hospital bill you cannot pay. Right now, as Congress discusses proposals to cut federal budgets for Medicaid, there are at least 5 directions of change that could disrupt the lives of millions, especially the elderly, low-income individuals, and people with disabilities. And no one can be certain these won't happen soon. The federal government is considering reducing support for states that have expanded Medicaid. This might sound distant, but it means states will be forced to struggle to maintain the system. And when budgets aren't sufficient, cutting services or tightening eligibility becomes almost inevitable. If you're living in such a state, are you sure you'll still qualify for Medicaid next year? Right now, you should check your insurance status. Ask your doctor. Ask your local health center. Don't wait until you're caught off guard to figure things out. Another proposal being debated is limiting per capita funding, meaning the federal government will only provide a fixed amount per person, regardless of what care they need. This presents a harsh reality. Those who need more medical care, those with chronic conditions or requiring long-term treatment, will be affected first. Treatment services might be reduced, costs might increase, and you might have to choose between treatment or endurance. Don't wait until you're denied payment to realize you should have prepared earlier. If you or your loved ones have regular healthcare needs, start reviewing alternative support options now. Another concerning change is the repeal of regulations that made Medicaid enrollment easier. Reforms in 2023 helped millions register more conveniently, reducing paperwork and the risk of losing insurance due to procedural issues. But if this regulation is eliminated, everything will return to how it was before. Cumbersome, error-prone, and very easy for a poor person to lose benefits just because of a missing signature or submitting documents one day late. What you can do right now is check if your records are complete, if anything needs updating. And if you're unsure, call your state's Medicaid agency for clear guidance. Not only that, an important financial tool, taxes from providers like hospitals, is also at risk of being restricted. For states struggling with healthcare budget deficits like California, without this revenue, the system will have to cut benefits or raise taxes. And you, ordinary citizens, will bear the consequences. If you live in a populous state where healthcare costs are escalating, this is when you should seriously ask, if budgets run dry, from which priority list will I be excluded? The final change sounds reasonable, requiring Medicaid recipients to prove they're working. But reality isn't that simple. Most Medicaid recipients already have jobs, just unstable ones without benefits, or they're caring for family members at home. Work requirements in such contexts are nothing but additional barriers. Millions could lose insurance not because they're doing nothing, but because they don't fit the administrative model. If you work part-time or are a caregiver, don't be complacent. Look carefully into new regulations that might soon be implemented in your state and prepare early to prove your employment status. Each change may sound small individually, but combined, they could become an undercurrent shaking the entire system you depend on. And the most dangerous thing isn't the change, it's that you weren't warned in advance. Therefore, don't wait until you receive a rejection letter to start investigating. Right now, you need to check your benefits, ensure your records are accurate, and update information from official channels. Register for notifications from your state, monitor what's happening in Congress, and if possible, share this article or video with those you love. Because in times like these, preparation is no longer an option. It's a vital part of survival. And what's more concerning is, what's happening doesn't stop at discussions in meeting rooms. Republican lawmakers are strongly pushing for Medicaid cuts as part of the budget deal. Meanwhile, the White House has declared it will veto any budget that includes significant cuts. This means a political confrontation is approaching very soon, and an already fragile healthcare insurance system is being stretched from both sides. At the state level, local governments aren't waiting. They're preparing for the worst-case scenario: narrowed funding, tightened eligibility rules, even ready for lawsuits if new regulations are enacted. But amidst all this, who will be directly affected? Patients, the elderly, low-income individuals. And if this system begins to crack, those cracks won't stop at the most vulnerable groups. According to experts, if the proposed cuts are approved, you might see consequences not just in Medicaid but in your local hospital. Patients without early access to insurance will wait until their condition is severe before seeking care, and emergency rooms will be the next to become overwhelmed. At that point, every citizen, including those not on Medicaid, will feel the impact. Skyrocketing healthcare costs, rising insurance premiums, as hospitals begin transferring unpaid costs to the community. And then, the impact won't just be for this year. When a generation of children can't access preventive care services, America may be entering a future that will pay a much higher price. No one wants this to happen, but once it starts, it can't be reversed with a meeting or a signature. That's why you need to view things not just in the present, but the entire road ahead. If you're thinking, I still have insurance, I can still see doctors, everything is fine, perhaps this is when you should pause and ask yourself, how long will this last? You may not control budget negotiations, but you can control how you prepare. You can proactively check your benefits, update documents, monitor notifications from your state, and ensure your loved ones aren't left behind. Because once the system starts changing, those who aren't prepared will feel it first. If this content helps you see more clearly what's happening, please hit like so others can access it too. Share this video with family, friends, or anyone dependent on Medicaid, because sometimes a small action today can help them avoid major risks tomorrow. And don't forget to subscribe to continue following important upcoming updates. We'll accompany you through each change, each new policy, with the clearest and most neutral perspective possible. Thank you for watching until the end. See you in the next video.